Hello, my name is Tess Nicholson and I am a third-year nursing student at JCU. I'm here today to give an in-service education session surrounding the use of integrated electronic medical records, or ieMR, in the intensive care setting, or ICU. The session will include an introduction to ICU and ieMR, the benefits of ieMR for nursing skill development in the ICU, and the challenges and opportunities associated with ieMR in clinical practice. Intensive care is a complex and arduous sector of nursing. Intensive care nursing demands a high level of technical skill and a composed demeanour. Intensive care nurses, or ICU nurses, are responsible for caring for patients with critical illness or injury, with patients ringing from neonates to geriatric. ieMR was first integrated into the Townsville University Hospital in July 2016, and since doing so, patient care has been revolutionised. ieMR allows for patients' medical records to be created, accessed, stored, and shared electronically. These records may include clinical devices, workflows and processes, such as care compass and progress notes from the entire multidisciplinary team, medication administration records, pathology, pharmacy, radiology, procedural information, and patient-related documents such as consent forms and advanced care directives. By combining these records of data, results, and key clinical information, it allows for the whole multidisciplinary team to access a patient's medical record from anywhere at any time. In 2017, the World Health Organization released an article named Medication Without Harm that stated that medication error and unsafe medication practice are a dominant cause of injury and harm in clinical practice worldwide. A 2017 study suggested that patients in the ICU are at an increased risk of medication error and adverse drug events due to elaborate drug regimes and complex illness. However, with the introduction of ieMR, there has been a significant reduction in prescribing errors and errors resulting in patient harm. The ieMR, and specifically the Electronic Medication Administration Record, or ieMR system, firstly creates more legible orders, and secondly calls for electronic barcode scanning from the patient's hospital ID band that allows for improved drug documentation and consequentially an increase in detection of medication administration errors through nursing interventions. This technology directly benefits an ICU nurse's ability to advocate for their patient, which is of vital importance as many ICU patients are unable to self-advocate due to barriers to verbal communication, such as endotracheal tubes, tracheostomy tubes, or other ventilators to assist respiration. Patient advocacy is an integral part of nursing, as outlined in the Nursing and Midwifery Board of Australia's Registered Nurses Standard for Practice, Standard 2.5, and therefore a technology that supports an ICU nurse's ability to advocate for their patient, promoting patient safety, is of huge benefit to the continuation of nursing skill development. Although there are clearly many benefits to the implementation of ieMR in nursing skill development, it is important that nurses fully understand the impact of technology on patient-centered care. Patient-centered care can be defined as care that is respectful and sympathetic to an individual's preferences, needs, and values, ensuring those values command all clinical decision-making. In a 2016 study, it was found that due to the implementation of technology at the bedside, Patients felt a level of discomfort as a result of practitioners being focused on a screen, demonstrating lack of eye contact, and feeling like they were not being listened to attentively due to excessive typing during assessment and conversation, demonstrating a lack of active listening. This study is a clear example of how the utilization of ieMR at the bedside may damage the therapeutic relationship between an ICU nurse and a patient, and result in a decreased rapport and trust, which is an integral part of ensuring patient safety and satisfaction. Another challenge which particularly pertains to intensive care nursing is the rigidity of documentation in pre-made boxes that do not take into account the unique complexity of each patient's clinical status. A 2019 study suggested the implementation of ieMR technology at the bedside directly affects a nurse's ability to critically think due to ieMR dictating a nurse's actions, moving nursing priorities from patient-orientated to task-orientated. ieMR presents very real challenges in regards to intensive care nursing. However, it also presents nursing staff with excellent opportunities to better their clinical practice. Queensland Health outlines the main benefits of ieMR as follows: patient information in real time in the correct place, safe and reliable care, decreased paperwork allowing for more time with patients, strong clinical and management data, clinical care and research of world-class standards, and improved efficiency. These benefits promote an ICU nurse's ability for holistic, patient-centered care, allowing them to integrate their high level of technical skill into clinical practice, but to also have the time for basic patient cares to ensure the comfort and dignity of a critically ill patient. In conclusion, the integration of ieMR in nursing in intensive care units has clear benefits in regards to patient safety, with early detection of medication errors through the ieMR system, which supports nurses to advocate on behalf of their patients. This is a clear link to the NMBA Registered Nurses Standards for Practice and allows nurses to continue to develop their clinical skill. However, ieMR still does pose particular challenges and opportunities in the sector of intensive care nursing. ieMR can promote a change in nursing priorities from patient-based to task-based, causing a decrease in a nurse's capacity for critical thinking, and may also damage the integral therapeutic relationship between a nurse and a patient through lack of good interpersonal communication due to technology at the bedside. ieMR also presents many excellent opportunities to elevate nursing care by allowing ICU nurses to improve efficiency, spend less time doing paperwork and more time holistically caring for a patient, and providing safer and more reliable care. Thank you for listening.